Addiction takes many forms. It can be drug or alcohol abuse, or out-of-control gambling, gaming, or sex. It can also appear as compulsive behaviors, such as overeating, shopping, or hoarding. These addictive and compulsive behaviors can affect people of all ages and all walks of life. Yet one thing they all have in common is reward deficiency syndrome, or RDS.
Reward deficiency syndrome is actually a genetic disorder that causes the brain to fail to produce enough of the vital neurotransmitter dopamine, which determines how we experience pleasure. Our brains normally produce dopamine as a motivational reward. The experience of pleasure is actually just the brain releasing dopamine to specific centers within it. In someone with RDS, there's simply not enough dopamine to sufficiently reward the brain. Thus, to make up for this dopamine shortfall, someone with RDS is simply more likely to engage in behaviors that generate more dopamine, many of which can lead to addiction.
The term reward deficiency syndrome was coined by Dr. Kenneth Blum, whose groundbreaking work into the hereditary foundations of addiction produced GARS, the first genetic test to help accurately predict a person's vulnerability to addictive and compulsive behaviors. GARS stands for Genetic Addiction Risk Score. It is a patented and clinically trialed genetic test available through Genius Health.
The GARS test starts with a simple cheek swab. Genius then takes the collected DNA and sequences it to certain specific genetic variants that indicate RDS and determine which behaviors a patient may be at most risk of developing. GARS is a risk score. It can't tell whether someone is or ever will become addicted. Instead, it assesses how susceptible a person is to the behaviors that lead to addiction. Addiction sufferers have always had to contend with not just addiction, but also with the social stigma surrounding it. At Genius, it's our hope that this emerging science can begin to erase that stigma and help people view the disease of addiction in a new light. We also want to help those with RDS to manage behaviors, cravings, and impulses.
In addition to GARS testing, Genius has also developed a patented all-natural pro-dopamine neuronutrient technology called RestoreGen that rebalances brain chemistry to help reduce cravings, increase focus, and alleviate stress and anxiety. Validated by more than 40 published clinical studies, RestoreGen is available in 6 different formulations. Each unique formulation is targeted to specific genetic variants so that RDS patients can manage their behaviors with great precision.
Sadly, there is no cure for addiction. But scientists and emerging technologies are paving the way for a much brighter future for those with RDS. Know your score.